Hello, I am Dr. Ashok Sharma. I am visiting consultant in internal medicine at Indraprasth Apollo Hospital, New Delhi. Today, I will be talking about a current medical problem, that is obesity. Initially, obesity was believed to be a disease of developed country or well-to-do persons. But nowadays, it is very common in low middle income group country, and in India last to 10-15 years incidence of obesity is highly increased, and 1/3 of the adult population in urban area in India is obese or suffering from obesity. Now, how we define that this person is fatty or he is obese? There are two criteria. One is body mass index, what we say BMI, which is calculated by height and weight of the individual. Normal value for BMI is 20 to 25. A person is having BMI of 26 to 30, then we say he is overweight. And if it is more than 30, we say obese. And if it is more than 35, we say severe obesity and very obese. And what are the causes for development of obesity in last 10 to 50 years is, first thing is industrialization and urbanization. It lead to change in the lifestyle of the people. People are working, changing food habits, consumption of fast processed food, consumption of calorie laden soft drinks, and decreased physical activity, excessive prolonged sitting in the offices. There is genetic predisposition also factor for the weight gain and obesity. There are psychological factor also because of depression, overeating, and socio-economic habits also, having parties and weekend outing leading to excessive intake of high calorie fast food. So obesity lead to hypertension and high blood pressure, lead to metabolic syndrome, diabetes, heart disease, indirectly affect the whole system of the body. So how to reduce the obesity? First thing is the diet. We should opt for the diet that contains high fruits, high vegetables and low fat dairy products, and we should restrict the salt intake. Indian diet is very high in salt, that is more than 10 gram per day, and we should reduce it to 5 to 6 gram per day. And third is we increase the physical activity, that one person should do at least 30 minutes of daily physical activity by jogging or walking. And fourth thing is he reduce the alcohol and smoking. Today I am talking about current medical problem, that is lifestyle disorders. With the increase of urbanization, increase in the lifestyle in last 10 to 15 years, fast growing with job requirement, competitive behavior, and decreased physical inactivity, leading to a group of disorders that includes high blood pressure, diabetes, heart disease, obesity, high cholesterol and behavioral disorders. This all group of disorders is known as lifestyle disorder because this is due to unhealthy and inappropriate lifestyle of the individuals nowadays, that of the young adults, which leading to these disorders. And most common of these is hypertension among all these disorder. Secondly, good thing is that this disorder can be preventable if we change our attitude of lifestyle and few changes, modification in diet and exercise and habits. If we not change it, it lead to hypertension, which in self lead to disorders like many complications involving the irreversible changes to heart, kidney, brain, eye, lungs. So we have to be cautious about the lifestyle changes. How we decide one person is young, healthy or following the proper lifestyle or not? There are number of daily practice collectively constitute unhealthy habits or lifestyle changes. If you eat more calorie and do less physical activity, this is one of the disorder. Second lifestyle disorder is you are taking plenty of salt food, especially processed and packed food. Third thing is sedentary lifestyle, no physical activity. Fourth thing is stress at office and home, both the places. Fifth is you are taking tobacco or smoking. Sixth thing is taking alcohol, that is 1 to 2 drinks per day or 6 to 7 drinks per week. And most common thing nowadays is poor sleeping habits. You are waking for late night and remain sleep deprived, and try to compensate your sleep during weekends, which is not possible. So how you have to improve your lifestyle? It is very easy. There are 4 or 5, 6 changes which you have to do to increase or improve your lifestyle or make it healthy lifestyle. First thing is your diet. You should decrease the intake of salt. You should decrease the saturated fat, that is butter, ghee and sweets, sugar containing beverages, and increase the consumption of fiber, vegetable and fruits to reduce the total calorie intake. Second thing, you increase the fiber intake and eat slowly and take small frequent meals and limit the intake of alcohol. Second thing is about the diet is physical activity. You should do 30 minutes of physical activity, that is moderate physical activity. That is ideal thing is go for 2 kilometers of walk, or that includes the steps of 4,000 to 8,000 per day. Or you can do a light activity also. You can do yoga, you can do Zumba, or you can do dance. Third thing is weight loss. So reduction of weight loss is done by both reducing the diet and increasing the physical activity, and measure your weight at least once a week. Fourth thing is sleep. At least one person should sleep 7 hours of high quality good sleep, and regular pattern of the sleep, and avoid extra hour. Turn off telephone and mobile phone and television before sleep, and there should be room should be dark and no noise in the room. Fourth thing is stress. You should reduce the stress. Best thing is do the yoga and meditation. So if we compile all the things, we reduce the salt intake, reduce the calorie, do physical activity, reduce salt intake, reduce butter, ghee intake, and reduce alcohol and smoking. This all can lead to your reduction in lifestyle changes, reduce your blood pressure, and this blood pressure can be reversible if you do all these things. Thank you.